Hey, it's Ed. Welcome to another edition of Ed Talks. Super excited. I have Dr. Jackie Gerhart with me. Jackie, welcome to Ed Talks.
Thank you so much for having me.
This is a cool topic that we're going to talk about, which is children's literacy and how it impacts healthcare because it's super practical and super, super important. And it's something most of us can relate to. We've ideally been the benefactor of being read to, and we've had the ability to give back by reading to others. So this is a great topic, but I think people are going to be surprised how important this is and that it is a leading indicator for overall health. So, Jackie, tell us a little bit about yourself.
Absolutely. So, I am a family medicine physician by background, and I had my residency here in Wisconsin, which is where I'm still at. And I had the pleasure of having a full spectrum practice. So, inpatient, outpatient, obstetrics, but really being able to see the life of and the health of people from birth to death, and the ability to have that kind of impact on a family and really have that kind of trusted relationship really helps me to be able to do the job of medicine that I always dreamed of, and that really is the best way to provide care. And so I've always been big on preventive medicine and trying to make sure that kids specifically are set up for success in their health and healthcare. So grateful to talk about that with you today.
Awesome. And I know from following you that you are involved in this program about reach out and read. Can you tell us a little bit about that?
Yes. So back when I was a resident, we had one of the first reach out and read programs at my clinic. And what it is essentially I, as the clinician, have a age appropriate book that I give out at each well child check, starting between 6 months and 5 years of age. And of course, I start counseling folks even before 6 months. So even pre-pregnancy about the importance of being able to interact with their child. And this is deeply important to me because as you mentioned, as a child, I was read to, and I really do attribute a lot of the success that I have had today just from being able to be well aware of the breadth of information and the learning and knowledge that I need to have around not just my studies, but also around my health in general. And I love Reach Out and Read because it's not sort of just giving a book. I use it in the exam. So instead of asking a questionnaire, which sometimes parents will either forget to fill out or they might not be the right questions that really get me the best sense of how their child is doing, I can just hand the book to the patient or the parent, and they can thumb through it, and I immediately can get gross motor skills, fine motor skills. I can understand social interactions. I really get so much out of that individual interaction, and it becomes this triple win, which is it's a very inexpensive way to think about preventive health. It is a way for me to get my job done in a interactive setting. And then it really is setting me up for this longitudinal base of them building this library and connecting with their community and their community library to try to find more resources for literacy.
That's so cool. And we will drop in the notes for everyone because I'm sure everyone's interest is peaked. More information on Reach Out and Read. And before we get into the sort of the why behind that, which is around children's literacy and how it's a sort of an indicator of overall health, I want to know from you, like, what is your favorite, like, what was the favorite book you got read to?
Great question. I loved Dr. Seuss books. I specifically remember reading Hop on Pop on repeat. I, of course, liked Goodnight Moon and The Hungry Hungry Caterpillar. But I, from a young age, would go to the library and stack up on books and just find myself in other worlds that made me feel like I could experience anything that maybe I couldn't necessarily from my place in Wisconsin. I've just felt like it is such an opportunity and a gift that we have, especially now in the age of media and everything being digital. We really know that as family physicians and as pediatricians that you should try to spend less time on the screen with your children and more time really interacting with them one-on-one. And so having resources to be able to do that and having that be part of a physician-led visit is really helpful.
Yeah, so true. For me, I grew up in Europe, and it was Lucky Luke, which is a French sort of youth child book. And also, and I know this is popular, a little bit popular in the United States. I've seen it here before. I think it's a family of hippopotamus, uh, family of hippos or something, and they're
Yeah.
all these characters. I think that was in English. So those are fun, and yeah, and I know, like one of our kids is Mensa, our oldest daughter, and I believe it's all because she had this voracious appetite for reading. And so all of our dates, I dated my kids, one day a week, all of them were at the library or at the bookstore, and she just consumed books, and she became a hyper intelligent person, I think, in large part because of that. All right. So let's talk
Amazing.
about children's literacy and health, right? Isn't that sort of like an indicator of health?
Yeah, early literacy is one of the single most powerful and most correlated metrics with your overall health. And it's not even just your preventive medicine and your wellness, it's also how you're going to interact in society, your wellness from a social perspective. And it's really something that outside of medications, it's really something that's like an intervention essentially that is going to best set kids up for success. And I used to in my practice actually have a old school prescription pad. It was literally had like a little RX on the side and it said books build better brains on the top. And I would prescribe like, please read, to your child 30, 60 minutes a day. And, next time that you come in, let's talk about how that's, keeping them on track for their different milestones. And it was probably one of the coolest things I could do because it would, even though we're in an electronic world, it was a good reminder that they could put on their refrigerator or by their nightstand to actually drive behavior, which we oftentimes know in medicine is hard to drive behavior. So
Yeah.
it was really great.
Jackie, I know you're super familiar with Epic. And how do you bring together this whole concept of reach out and read, children's literacy into Epic and making it super practical for people?
Well, one of the things we want to do is not just give the book out and have people grow, but also to measure the metrics and actually achieve outcomes. And so one of the things you can do within Epic is figure out how well is this program working? How many people have been reached? Is it something that's being done in your community and how widespread is it and so forth? And I think there's two resources I would recommend. The first, we have a one pager that essentially a parent, a patient, anyone listening can actually go to their clinician or to their health system and bring them this page that says, hey, this is how you get started. And not only this is how you get started from how to get involved with Reach Out and Read, but also this is how you can actually prove quality improvement over time. And I'd love to be able to share that resource as well. And then the second one is really just trying to get the sense of this is a very low cost triple win again of being able to engage with your community, engage with preventive medicine and really do something that's going to have such a impact on the future of our society that it should be an easy win for every healthcare organization to want to do something like this.
Love it. Super practical and it's almost free and it doesn't require to go into the pharmacy and taking a med. I love it. Jackie, thank you so much for sharing your heart and your passion around children's literacy. And again, we'll drop all the resources in the comments section.
Sounds great. Thank you so much for having me.